everyone, I am Ashley Batigdas, student nurse of Asian College of Technology. So for today's video, I will be doing a return demonstration for physical assessment 2. So now I will be introducing myself to my patient. Good evening, sir. I am Ashley Batigdas, student nurse of Asian College of Technology. So, and I will take care of you from 8 p.m. to 4 a.m. in the morning. For safety purposes, may I hold your hand as I check your ID band, sir? Okay. May I know your name, sir?
That's Alvin, ma'am.
And when is your birthday?
September 5, 1998, ma'am.
Okay, sir. Okay, sir Patigdas.
Sir Patigdas, so now I am doing an assessment on your chest, heart, and vessels on your neck, breast, areola, nipples, jugular veins, thorax, scapula, ribs, temperature, spinal cord, alignment, vermitus, abdomen, skin, and bowel sound. Okay, Sir Patigdas, I would like to ask your consent, sir, if it is okay. I will going to touch certain parts of your body. Is it okay? Okay, sir, thank you. Please assure that all the documents are completely confidential between me and the attending physician that I will be referring to. Is that okay with you, sir? I will now provide privacy. Close curtains to the bed and close door. So now I am preparing the materials needed here. We have alcohol, centimeter ruler, stethoscope, gloves, and chart. Now I am going to perform hand hygiene to prevent the spread of microorganisms. Now, I am going to inspect the size, shape, and symmetry of breast, which includes areola and nipples. So his breasts are even, it is symmetrical at rest, the areola is rounded or oval with same color, nipples are red, averted some size at equal color. No orange pale skin is noted, which is present in edema. The veins may be visible but not engaged and permanent. No abuse must noted. No fixated and moved militarily with hands are abducted over the head or in the leaning. No retraction or template. Next, I will be palpate breast. So each areola areas are carefully palpated to determine the presence of underlying masses, and each nipple is gently compressed to assess for the presence of masses or discharge. After palpating his breast, no lumps or masses are palpatable, no tenderness upon palpation, and no discharge from the nipple. position in the neck that occur in several waves with each cardiac cycle. Palpate entire pericardium methodology using the palms and the fingers, beginning at the apex, moving to the left external border, and then to the base of the heart. While palpating, there is no palpatable position over the aortic pulmonary and mitral valve. Apical position can be felt on palpitation. No noted abnormal heaves and thrills felt over the apex. Auscultate heart in all anatomical areas, aortic, pulmonary, tricuspid, and mitral. Listen for the S1 and S2 sound. Listen for abnormal heart sound like, for example, in S3 and S4. Add more Morse count heart rate at the apical pulse for 1 full minute. So, S1 and S2 can be heard at all anatomical sites. No abdominal heart sound are heard, like for example, Morse cardiac rate range from 60 to 100 beat per minute. Assessing the patient, I asked patient him if he had difficulty in breathing, if he had chest pain, cough, if he smoked. I also asked him if he had respiratory problem to assert the anterior and posterior thorax, inspect the skin color, presence of hair, molds, skin breakage, scars for the posture and shape of thorax, inspect the size, shape, and symmetry. While I palpate for lumps, mass, and areas of tenderness, I proceed in observing for symmetry and position of scapula or sternum. I palpate the skin and tissue over scapula for signs of swelling and or tenderness. I proceed in observing of symmetry and position of scapula or sternum. I palpate the skin and tissue over scapula for signs of swelling and or tenderness and sign of dislocated bones. For intercostal space and movement, I am going to assess symmetry and movement upon breathing. Palpate skin over posterior thorax. Now for symmetry of the thorax, from posterior and lateral views, rib structure and movement. That's for rib symmetry, structure, and movement. For temperature, palpate the skin over posterior thorax. Do pitch test at the back of the head to assess hydration. That for skin trigger. For chest exertion, inspect and palpate posterior chest. For respiratory exertion, palpate and assess the chest where tackle or perceptible vibration. Feel through the chest. Musculate the posterior chest for fremitus as the client picks that for vocal fremitus. For breath sound, sculpted posterior thorax using the flat diaphragm of the stethoscope. Determine whether the lung tissue filled with air, liquid, or solid. Locate the need posterior thyroid gland bags for chest wall percussion notes. The chest wall is intact with no tenderness and muscle. There is a full symmetry, expansion, and thumbs separated 2 to 3 cm during the inspiration when assessing for the respiratory excursion. For the clients manifested quiet, rhythmic, and effortless respiration. The spine is vertically aligned. We have normal breath sound without dyspnea. He varies to light to dark skin uniform. Expect at areas frequently exposed to sun. No sign of wounds or skin breakage. provide an abdominal assessment. Be sure that the client has entered the bladder. And that would be all for performing physical assessment to return demonstration. Thank you.